in for Tim.
In for Tim.
How much time do you guys spend talking about COVID lately?
I mean, look, this is one of those things. Don't be scared, right? This is one of these things that it's we knew it was going to be part of the evolution of the disease. It's the waves of it, right? You notice it where people are missing from the office, and it happens, and you see it cycle through the office because somebody gets it and it goes around, or it's in someone's family and then they're out for a couple of days.
Yeah.
But
or you start seeing masks again in the office by a few people.
Which I very much respect, because I think it's very respectful. But the idea that this is going to be something, and actually we're much better prepared than we were.
We know how to deal with this.
Having said that,
as we get ready for a new strain.
This is the next development on this story, of course, something that we have been told to expect as we move on from the pandemic stage. Joining us to discuss, Dr. Amish Adalja, who is Senior Scholar and Infectious Disease Physician at the Johns Hopkins Centre for Health Security at Johns Hopkins Bloomberg School of Public Health, supported by Michael R. Bloomberg, the founder of Bloomberg LP and Bloomberg Philanthropies. Dr. Adalja joins us from Pittsburgh, Pennsylvania. Great to have you on the programme. Have I framed this correctly when we're talking about a new strain of COVID?
Yes, I think so. I think that we always knew that this virus was going to continue to evolve, and the goal was to really decouple cases from hospitalizations, from deaths, from hospitals in crisis. And I think we've successfully gotten there. And the thing is, we think of COVID, we've got more tools for COVID than we do for any other respiratory virus. People wish we had the tools that we do for COVID, for influenza, for example. So I do think that, yes, we're going to see new variants. There's always going to be one coming in perpetuity, but it's less scary because we've got so much immunity in the population and so many tools that science and medicine have developed.
So great that we've got tools. Having said that, is COVID in the same category now as, the regular flu that we deal with every fall? Do you put it in the same category?
It's still a little bit more severe for older people, for high-risk individuals than influenza. And it also doesn't have that kind of single season jump like you get in respiratory virus season with flu in fall and winter. We still get this kind of surge in the summer and then the winter surge. So it's a little bit different than flu. It still is likely killing more people than flu, but it is rapidly approaching the level of influenza. And I think we will get there if more high-risk people take advantage of new vaccines, take advantage of drugs like Paxlovid and Molnupiravir. So I think we're getting there, but it's still, if you look at it on a pound-for-pound basis, it's still a little bit higher than influenza.
What can you tell us about this new strain then? XEC, it's called.
So XEC is a variant that really came to light in Europe. It's a combination of two different versions of Omicron variants that have been circulating. So it's what we would call a recombinant variant. And it does seem to be increasing in many parts of Europe. There have been cases in the United States, but in the United States, it's less than probably 1% of infection, so it's not officially being tracked. But you have to remember, if it's not XEC, it's going to be another variant. There's always going to be one variant coming up, one variant coming down, one with their moment in the spotlight, one that's kind of fading off to the side. And that's always going to be the case. And it's the case with any other respiratory virus. It's just that the media are much more interested in COVID variants, even when they don't really change the equation. So yes, XCC might become a dominant variant, but does it change anything that people need to do? Probably not. Does it have an impact on the efficacy of the newly updated vaccine? Probably, yes. But is it going to change the equation or how people live with COVID? No.
Well, talk to us about vaccines. I did not get the latest. I mean, I'd gotten 4 or 5 shots, as we were supposed to during the pandemic. Having said that, I don't think I got the last one and I kind of passed. I don't know. So what's your guidance on getting vaccines? Should we treat it like the flu vaccine? Get it. If you're high risk, get it. Just get it. Like, what's your advice here to people?
Well, I think if you're high risk, you definitely benefit from staying up to date with your vaccines.
Right.
And high risk means people that are overweight, people that are obese, people with diabetes, hypertension, immunocompromised, people who are pregnant. It's a large swath of the population that probably should be getting that vaccine. If you're a low risk person, 20 years old, no medical problems, you're probably not going to get very much of a benefit from the vaccine. You'll get some transient protection against infection, which will wear off. And I think, I've always been of the mindset that's in the UK, that's in Europe and even in Canada, where there's much more targeted vaccination to high-risk groups. I think that's much better than a universal recommendation, because what's happening is high-risk people aren't, they think everybody gets this, that they're not special. when they really are. The virus does treat them very special. They're at higher risk for severe disease. And I really think we need to get our high-risk populations vaccinated, because if we're vaccinating a bunch of healthy 30-year-olds, but not 70-year-olds, that's not going to really do anything to put a dent in, the tens of thousands of deaths that will occur from COVID-19 over this winter season.
Yeah, that's interesting to your point. I mean, my parents in Dublin get a call from their local doctor to say
it's
time. Yeah. If ever, and it's happened every year, and it depends
That's
again on
yeah.
risk category. Another topic that we wanted to talk to you about, though, is the new flu vaccine. It's going to be different. This is an option that might actually perhaps encourage people that might be scared of needles to go for it.
Yes. So we've had this vaccine around since around 2003. It's called FluMist. It's a nasal flu vaccine. So it's needle-free. It's basically a spray that's sprayed into your nostril. And it's now been approved by the FDA for self-administration, which is the first vaccine that we've seen be approved for self-administration. So this is a very innovative way to increase flu vaccine rates. Hopefully, people who are needle phobic, people who don't have the time to go and find a place to get a flu vaccination, will take advantage of this. So I think this is kind of a really important development, hopefully one that people will take advantage of, and hopefully which will lead to a precedent for more self-administered vaccines, self-administered tests, because I think that really gives people a lot of autonomy and will hopefully increase guidance recommendation adherence, and more people will get flu vaccinated, and this is just another way to do that.
Couple things. My understanding is it's indicated for individuals from like maybe 2 to 49 years of age. Is that the case? Do you need a prescription, and is it covered by insurance?
So it is 2 to 49 because FluMist, that brand of flu vaccine, is only FDA approved for that group. It doesn't mean it doesn't work in other groups. It just means that the company didn't actually seek approval in people that were younger than 2 or people that were older than 49. So that's where the restrictions are. And what the company is going to do is have a website set up, kind of a third-party website, where you kind of do a questionnaire, and if you meet the qualifications, they will ship that vaccine to your home for you to give yourself or to give to your children. Insurance, I suspect, will cover it. It may vary from plan to plan,
right?
But I think they should cover it. There's no reason that they wouldn't, because it's a recommended vaccine and they cover other flu vaccines.
Great update, certainly on something that is still a part of our world. We're talking about COVID and just flu, certainly important. Dr. Amesh Adalja, Senior Scholar, Infectious Disease Physician at the Johns Hopkins Center for Health Security at the Johns Hopkins Bloomberg School of Public Health, of course supported by Michael R. Bloomberg. This is Bloomberg Business Week.